Typical antipsychotics, such as thorazine, are powerful chemicals originally designed to shut down the central nervous systems of mental hospital inmates. They are now mainly used on people with serious mental problems, and they can cause feelings of helplessness, deterioration of the mind, neurological damage, dementia, trembling, twitching, and damage to internal organs, to name a few.
Most of the medications that are given to clients, whether they're SSRI medications or they're antipsychotics, a lot of the pharmacology of these medications, they don't even know how they work in the first place.
But it has been noted that there is one primary side effect of psychotropics that is common to all.
Most medication and psychotropic medication, I've noticed, tends to flatten the things, so that while you're decreasing the depression, you're also decreasing the joy. And so you're minimizing what it means to be human in the service of avoiding dealing with a problem.
They can't connect to the world around them. They feel like there's no feeling, which is, you should have some feeling there.
All that's doing is really numbing them down, and they're not doing the work that they need to do to resolve that issue that's going on somewhere internally.
But the numbing of emotions is not the only way psychotropic drugs affect the user. Each of the 5 main classes of psychotropics has side effects of its own. Of all the side effects experienced by users of psychotropic drugs, the most horrendous may be an intense inner agitation and restlessness, known as akathisia.
These drugs can cause something called akathisia, which causes people to become very agitated, and actually a little nuts, a little off balance, and they'll do things that they never would have done before, things that are totally out of character.
This is a normal person without any history of auditory hallucinations, and all of a sudden they'll say there's voices telling them this is the only way to stop the pain, it's the only way is to kill themselves.
Had patients tell me that they never, ever, ever had one single thought about suicide in their entire life until they started on the drug.
An estimated 10 to 25% of SSRI antidepressant users, close to 7 million people in the US, experience akathisia. And Psychiatry's Diagnostic and Statistical Manual of Mental Disorders even admits the connection between psychotropic drugs, akathisia, and suicide. The statistics back this up. The suicide rate of the general population is less than 11 for every 100,000. But for every 100,000 people taking SSRIs, the suicide rate jumps to 718, over 65 times more. And yet, we are told daily by psychiatrists and drug companies that psychotropic drugs actually prevent suicide. So, what are we to believe? One can start with the drug company's own warning letters to doctors, or unpublished data for the antidepressant Effexor, or an analysis of Prozac using the FDA's own statistics, or even a British House of Commons report on Zyprexa. Of course, not everyone commits suicide, but the huge volume of other side effects can be horrendous.
The medication that the psychiatrist prescribed me made me feel awful. Constant headaches, constant nausea, wanting my skin to turn inside out, just feeling like bugs were crawling all over me all the time.
It made me feel like all slow and like sluggish and stuff. Like, and when somebody would ask me something, it would kind of like take a minute, like, what?
These drugs have affected my heart. They have affected my liver.
Weight gain one time, hit like 40 pounds.
These thoughts come over me like I wanted to kill somebody. I wanted to really hurt somebody.
It just sucks all the life out of you. So you're like a body, like a machine.
I didn't want to live. I didn't have the desire to live. I felt miserable.
You just can't live, you'd just rather die. Because there's no living when you're hallucinating every day.
I actually tried to commit suicide with my psych meds.
At some point when you realize that you are really just existing, you're not living, at some point you realize you need to take the risk to get off.
But what about those who say psychotropic drugs really did make them feel better? That for them, these are life-saving medications whose benefits exceed their risks. Are psychotropics actually safe and effective for them?
So what ends up happening is that someone feels good for a while, and then very often they have to have their dose increased, and then they feel good for a while, and then they might have to have it increased again, or maybe they'll switch agents. So it's that kind of a story if you're not actually getting to the root of what's going on.
I think the research is pretty clear that then all of a sudden starts to change, and you start to have a supersensitivity to being depressed, in which case then they become more depressed, and then they're chronically depressed.
And there is ample evidence that if the short-term side effects of psychotropics don't get you, the long-term effects will.
Psychiatric drugs are toxic to the body. They do build up in the body and add to the body's reserve and reservoir of toxins that will suppress the immune system, and the body will try and fight them as foreign objects.
If they're on these medications for years and years and years, I mean, one of the things that we know about adults and some of the, for bipolar and schizophrenia is that they're dying at younger ages, and these are adults. So if we're starting this medication approach with young kids, what is their life expectancy going to be?
No one's really examined it or is looking at the big picture, which is what's it really do to a society with a proliferation of mood-altering, emotion-altering, or blunting in a society at large.
And I think we're going to really see a huge increase in violence and suicide and a lot of bizarre behaviors that we haven't seen, because for a very short period of time, only in the last 60 years, have we really started medicating, intoxicating our brains with these incredibly toxic substances.
The very real probability of significant long and short-term side effects should give anyone considering taking psychotropic drugs great pause. But what about those already taking them, who, no matter how hard they try, cannot get off?
The majority of National Institute of Mental Health and National Institute of Health scientists are getting more money from drug companies on the side than their tax-based salary.
With so much money to be made, all psychiatrists needed was a scientific theory to justify it. Their solution? An official report declaring that all mental problems derive from a so-called chemical imbalance in the brain, requiring drugs to correct.
This chemical imbalance is one of the greatest fallacies ever foisted upon patients and the public. There is no chemical test to show an imbalance related to any psychiatric disease, whether it's depression, anxiety, what have you.
The chemical imbalance is for the benefit of the psychiatrist. It has to be there so that psychiatrists can treat it.
But fraudulent chemical imbalance theories could not hide the mounting evidence of common and terrifying side effects, such as akathisia.
Akathisia is like an extreme inner nervous agitation. People describe it as wanting to crawl out of their own skins. And this happens with great frequency, and it is absolutely, totally well understood to be associated with suicide and violence and homicide.
After years of these reported side effects and cases upon cases of violence, self-mutilation, and death, in 1991, health experts, legislators, and the public finally forced the FDA to order an investigation.
I know with absolute certainty that if Charles had any idea of the side effects of Prozac, he would never have taken it.
I had two sons, David Lee, age 8, Billy 16, wife 20 years, all gone. I'll tell you why. After being on Prozac for 21 days, my wife shot and killed both of these two boys right here. She turned the gun to herself and shot herself twice.
I took the 9mm automatic, sat down on the bed and put the gun to my head, and I blew a 4-inch hole out the back of my arm instead of my head. Thank God I was a lousy shot. Had someone looked further into Prozac, steps could have been taken to avoid it.
What serious side effects should I have been warned of?
Well, drugs such as that can cause depression, it can cause dizziness, and there are many isolated reports of almost any area of the body being affected by those. These are the ones that cause the depression, the suicidal thoughts, the heart disease, the metabolic defects. And I think that obviously lung function and cardiac function need to be monitored on children if they are finding enlarged hearts and the children are having heart attacks and strokes and increased blood pressure and irregular heartbeats. And it was found that many times when you stop these drugs, the symptoms don't disappear. You think the shaking is going to go away. It may not go away. And there's nothing more devastating to a young child than to twitch and have these jerks in their body that they can't control. You should have been told to watch for any change in how your son feels or acts or behaves. I'd say that you shouldn't have to be the doctor, but in today's day and age, with so much going on that shouldn't be happening, I'd say parents, go check on what your children are taking. Don't assume that it's normal to have a reaction if you're seeing one. Call your doctor up and complain. Get a second opinion. But you've got to cover yourself in every way that you can possibly cover yourself. I think you can't drug healthy bodies and make them unhealthy in so many ways and expect those individuals to grow up to be a functional, creative persons in the society. They simply won't be able to reach their full potential because the drugs change them. I think that what is going on is a sin. God must be standing up there saying, "What are you doing down there?"